Hi everyone, I want to talk to you about first antenatal visit. Oh, congratulations, you're pregnant. Okay, what's next? Well, you need to be visiting the clinic for regular follow-up. Okay, the very first one. What is it all about? Why is it important? Let's go. The first visit is best just before some investigations could be done. For example, chorionic villus sampling is done between the 10th and 12th week of gestation. So if you have presented early before that time and anything could be done that will warrant that procedure, then you're fine. Anytime between the 8th and 10th week should be fine for almost everybody. You can present earlier if you have any problem. So don't say, oh, I'm not yet 10, I'm not yet 12, so it's not yet. Please go immediately. Many women will visit in the first trimester, but a large number will not until the second or even the third trimester. Some will only visit during labor. In other words, never had prenatal care, and that is pretty dangerous. History and examination on your first visit. Your expectations should include, but not limited to, thorough history about this pregnancy. The doctor will go over everything that is necessary to gather from you so that he or she will know what he or she is dealing with. And if you've been pregnant before, history about the birth, any problem in that pregnancy, the outcome, is it abortion, is it preterm baby, is it term baby, is the baby alive, any issue in the child at birth, Apgar score, and everything will be asked. Why? They want to make good preparation for this very one. They will ask you about your gynecological history. I'm not going to go into details of that now because I'll make a separate presentation on that. And of course, your general history, the fact that you're pregnant doesn't mean you may not have any other problem in your life or any other health-related issue. So they will ask about everything. Family history, particularly when it comes to genetics. Family like the blacks, sickle cell disease, Mediterranean with thalassemia, and the white European descent with cystic fibrosis. No, just has history that are relevant to being pregnant and the fetus in you. And of course, the social history was about smoking and alcohol. I've made presentation on fetal alcohol spectrum disorder. Please check it out. And I made separate presentation on alcohol as well. Kindly check that out because all this will affect the outcome of this pregnancy. And they will do physical examination, check you from head to toe, make sure that you're fine. And they will ask, on whatever is abnormal through the history or the examination. So take your time, be patient with them, they're kind to you, they want to help you. Expected date of delivery and gestational age. Some will say, oh, it's talking to doctors, it's not talking to me. Well, we estimate the expected date of delivery and gestational age as of today, as of the day you'll be visiting your doctor. It will tell you exactly how many weeks and number of days, but not going to get the number of hours. Somebody's laughing somewhere. Okay, why? It's very, very important to know the exact day so that we'll be able to fine-tune the best way to help if we encounter any problem in this pregnancy. We don't pray for it, but we just need to be equipped. And one of the most important tools to get in managing pregnancy is knowing the exact date of that pregnancy. Um, Last menstrual period is very important. to those who have regular menses and to those who keep the record. Some have regular menses, but they don't keep the record. Some keep the record, but it's irregular. So to those who are keeping the record and it's regular, fine. We may not bother about ultrasound at the early part of the pregnancy, but if that is not the case, then we'll do ultrasound. So Nagel's rule plus 1 year minus 3 months plus 7 days, you can do it on your own. There are so many calculators online that this is what we use in medical school. For example, if the first day of last menstrual period is February 5, 2019, the EDD will be expected to be on November 12, 2019. You can do ultrasound if there's regular menses, or you can't remember the date, or the uterus appears bigger than estimated, and is best done in the first trimester. The older the pregnancy, the more likelihood of the ultrasound not getting the accurate date. There will be another details on that in another presentation. Accurate gestational age is very vital to appropriate interventions in pregnancy. Your blood will be taken for investigation as well as your urine. What are they going to be looking for? Yeah, complete blood count to be able to rule out anemia, and they want to determine if you have infection going on unknown to you or not by checking what is happening to the white blood cells. Are they too low or too high? I'm going to help you out about that. The analysis, what is going on, Rubella antibodies so that they'll be able to cancel you appropriately. And ABO blood group, yes, you might need transfusion later or just to know your level. Are you A positive, AB, or O negative or O positive? Rhesus, yes. We want to know particularly if you, the pregnant woman, if you are Rhesus negative, we have to know the Rhesus status of the father of the baby that's coming. Now, and that is if the father is Rhesus positive and you are negative, then we'll be telling you about possibility of using Rogan when investigations are done or when you have bleeding. In any way, you'll be fully informed. But prepare your mind, Rhesus status should be determined. HIV, you have to sign consent. It will be good if you can sign the consent. When you sign the consent and it's done, if you are negative, congratulations. If it's positive, don't worry, you'll be helped. They will place you on medication appropriately. And hepatitis B screening, group B could be screened at gestational age of 36 weeks. Then pap smear will be done to determine whether there is ongoing cancerous changes along that region. We are still doing our laboratories, syphilis, we screen, chlamydia and gonorrhea, Zika virus. Yes, in some parts of the world where this is available, if you have visited that region, that will be done when you are back. But if you are living in that region, they will do that also. Cytomegalovirus, thyroid function test, urine culture, urine microscopy culture, and sensitivity to rule out bacteriuria in pregnancy. Why? You might have it, but you are not showing signs and symptoms. And to prevent pyelonephritis in you, they will do that. Part of the stuff that be done during this first visit is to ask about possible abuse at home. You should voice your concerns and you'll be told the outcome of the laboratory investigations. If any serious concerns, you'll be referred appropriately. The schedules. When are you expected at the clinic again? I'll target next appointment could be if the pregnancy is between the first week and 24 weeks, they can place you on every 4 weeks appointment. But if you are already 24 weeks going to 36 weeks, it will be every 2 weeks. If you are greater than 36 weeks, it will be every week till delivery. It depends on the protocol at the center you'll be attending. This schedule is not rigid. It's not rigid. If you are a high-risk one, for example, any problem like sickle cell disease in blacks, heart disease, lung problems, anemia, and so on, you will likely be given shorter days apart. Why? That will afford the doctor of a close watch and appropriate measures on timely basis. The investigations at this first visit could be genetic counseling and testing, depending on the situation, or anything as you may request. But genetic counseling and testing, particularly in older people, or if there's family history of genetic disorder or chromosomal anomaly in any way. Your age will determine that. Your interests will determine that. Whatever is big on history will determine that as well. So, in conclusion for now, I will say again, congratulations on your new status. Being a pregnant woman is a big task. Endeavor to see your doctor on a regular basis and at any time you have any concern. Wishing you a safe delivery. Thanks for listening to my presentation. Kindly subscribe so that you can get these presentations immediately they are published. Thank you.